Good morning. How's everyone? How's the jet lag for those of you coming from the East Coast? It's real. I understand. Well, thank you so much, Steve. I'm really happy to be here and just share a little bit about the journey that we've been on here at Genentech. As Steve mentioned, I am the first Chief Marketing Officer that Genentech has had. I was hired into this role in July of last year, so I'm on month 6 or 7, depending on how you count it in this new role. Before that, I had a global position heading up oncology strategy for our Roche Group product strategy organization. Spent a little bit of time at Gilead, and then as Steve mentioned, I had 10 years before that at Genentech in roles across analytics, market research, sales, and marketing. Before that, I spent about a decade as a bench scientist. I'm an immunologist by training, and so have a somewhat atypical background for someone leading a 400-person marketing organization. I must say this is a dream job for me. I am over the moon happy, have never been busier in my life than I have in this role, and really excited to share a little bit about the journey we've been on so far. So I think many of you are familiar with Genentech, but if you're not, I'll sort of ground you in sort of our legacy and how we've come to be this organization. Genentech has been around for 40 years. We have been bought and owned by Roche Group, which has been around for 125 years. And we have a legacy of making innovative medicines. And it's a really interesting position to take in a pharma organization now, given the advent of biosimilars and generics and moving into more efficient ways of producing medicines. We've taken the stance that we will continue to innovate, and that is how we continue to grow our portfolio, rooted, of course, in what we believe to be world-class science. What that means is every time we've launched a new medicine, our most recent run, Lunsumio, is the first bispecific for follicular lymphoma. It means that every time we stand up a new molecule, a new product, we also stand up a new team. That's how we have grown historically as an organization. And so it means then that we have what I call silos of excellence. We build teams around our therapeutic areas. That's how we've been historically organized. And we have focused solely within the therapeutic area and on science. From a marketing lens, what this means is we have focused mostly on communicating science, not necessarily on a customer or patient experience, not on developing the trust. We believe that the science speaks for itself. I believe that is true. However, in today's world, certainly post-COVID, the demands and the expectations of our patients and our customers are all the more higher. We don't get any slack anymore for being a pharma company. People expect information when they want it. They want us the hell out of their lives when they don't want to hear from us. And so our mandate is really tough as a marketing organization. So that's a little bit about how we have come to be. I've come into this role inheriting 15 marketing teams, again, all sort of stood up around our therapeutic areas, a little under 400 people, all of them working pretty much in silos. And so my mandate coming into this role is easy: create a world-class marketing organization. Okay, piece of cake. So yeah, we'll be done in a few weeks, right? So one of the things that I came into this role sort of proposing to my teams is that our industry is ripe for the kind of digital transformation that we've seen in many others. Those of you who touch consumer goods, none of this will come as a surprise to you, but for our industry, and particularly for Genentech and our legacy, we've been doing marketing essentially for the same way the last 15 years. And we believe that now we have all this information, we have all of the tools. You guys are experts on that in a way that I am not. But we do know that there is an opportunity for us to go from hailing a taxi to hopping into a driverless car. That day is here today. And so my proposal to the team is, how do we leverage everything that is existing around us, the data infrastructure that we have, all of the tools that are available that we are currently investing in as an organization, and apply that in a marketing context. We know that we have the demands of our customers changing. We know that our patients demand it of us and expect it in real time, day to day. And we are still producing tactics in much the same way as we have 15 years ago. So we have a lot on our plates to do and a lot to go forward with. So what I wanted to focus on is not necessarily the nuts and bolts of creating the digital transformation, but what it means to shift a culture in an organization that has grown up and has rooted its legacy and its pride on how we have done marketing for the last 20 years. That's sort of where my work is really cut out for me. And it's been really interesting to see the variety of perspectives that I have from my marketing organization. Out of 400 people, you can imagine I have an entire spectrum. I have folks that are chomping at the bit to go forward and to really move into this future. Most of my organization is a little bit curious and somewhat skeptical, right? And some of that has to do with everything from what will this mean for my career? You know, I have set my sights on becoming a leader in a marketing organization, and now you're telling me the rules are different. You're shifting the sand underneath my feet. How do I grow my career? Everything from that to, you know, I'm out with my customers and we're out with our field organization and we see what works and this is tried and true. Why do you want to change everything, Erica? And so I'm really trying to understand all of that and move this organization forward from a cultural piece. I've got a smaller minority of folks who are really out of, you know, sort of, you will pry my tactics out of my cold, dead hands, sort of really resistant to some of the changes. I imagine that a lot of them will come along ultimately. And so one of the challenges that I face, being both an insider and an outsider, is how do you motivate and inspire an organization that has been incredibly successful without having to make change? And that's really sort of pointing them to the future and really trying to be as inspiring as possible. You could argue that if you wanted to bring in a cultural shift, you would bring in someone else from another organization, right? Like there's a lot of models where tried and true, you bring in a new C-suite person and their job is to come in and shake things up. I think it's a really interesting perspective to do it as an insider. And so one of my advantages is I know most of these marketers. I have relationships with these individuals, and it affords me a better and deeper level of conversation with them to understand where they're coming from and where we're going. On the other hand, it's also easy to get stuck in that way, and it can be easy to lose the ability to disrupt things. And so I'm kind of walking this balance of leveraging what I know and the individuals and the inspiration that we can provide, and still feeling like it's okay to break some things. So one of the things, for example, we are working on this year, we have a lot of things that we're trying to do, but one of them is disrupting how we work with our agencies of record. And part of my thesis to the organization is, you know, we work with almost 60 different agencies across our portfolio. I cannot integrate a seamless customer experience across 60 different partners. And my team say, yeah, okay, Erica, I get that. That makes total sense, but I don't have to change, do I? And I say, indeed, you do. And one of the things that we're embarking on is really kind of creating the trust and the inspiration around what is possible if we're able to design solutions and, importantly, capabilities that will move us into our future. So we're embarking on this work right now. I have every team from saying, oh, I'm eager to work with a new agency partner. Those are my folks that are probably be first out of the gate to make this transition, to those that are saying, hey, we've got to launch this summer. How exactly am I going to transition agencies while I'm launching? All of that we have to solve for, but my insistence is we're all going to go and we're all going to do this at the same time. And this is not going to be easy, and it's going to be a challenge, and what we have is each other and the goal of what will happen on the back end of this. And I have to pay off the with them, if you will, that at the end of the day, having fewer partners, fewer agency touch points, more seamless integration across HCP, patient, access, our institutions, and an ability to localize and personalize our messages actually makes marketing fun again. And I'm trying to guarantee my organization that you'll do less. You will have more messages that are customized and personalized, but you will actually spend less time creating them and leveraging all of the digital tools that we have available to us. So these are some of the things that we're working on as our organization here. When I think about where we're headed and what we're trying to go on in this journey is where we were before. We have, as an organization, exalted strategy and less so on execution. That's why that font is small. We have put strategy on a pedestal. I think we do a really great job at that, but we don't do a lot of marketing execution. We have prized therapeutic area knowledge versus localized and personalized insights about our customers and patients. This is something we really have to shift. And it's a really interesting position to do this as a trained scientist. I love the science. But at the end of the day, science is accelerating. How we communicate it has to get simpler and clearer and much more meaningful to the people we're interacting with. That is how you create trust. Marketing at Genentech has been a pass-through organization. That is to say, people come to marketing to get some skill sets, and then they move on and do other things outside of marketing. Again, I have an atypical background. The only thing I want to do is marketing, and I want to create an organization that is a destination. I want marketing nerds in my organization, not folks here to kind of go do the next thing. So this is where our future is, and really trying to shift not only the cultures, but the incentive structures around execution. And that goes from everything from how we reward and recognize people to what we describe when we promote somebody. Let's talk about the impact that they've had. Let's talk about the executional metrics, not just the strategy and the strategic thinking that they bring to a new role. When we think about our personalized insights, how do we get to an N of 100 maybe for our HCPs, an N of 10 for our patients when we want to interact and communicate with them? Right now we write one message, typically. We might write something different for an access audience, something different for an HCP. What we fail to do is write culturally competent messages that actually reach people where they are. What we fail to do is to understand that while for us we view them as patients, what they are also are people. And the fact that they are a patient, particularly on a Genentech product, is usually in the bottom 100 of the things that they like about their life. And so how do we meet them where they are with that level of empathy to build the trust so that they can have a great experience when they are interacting with us? Again, as I mentioned, marketing as a destination, that is something that we're working toward, and it's hard. Our teams are fixed in size for the most part. We're working in a resource-constrained environment like many of you are, and so all of the layers that we used to have for promotion and all of the recognition that people really feel is tangible for a high-powered, ambitious group of people, we're losing those. We don't have as many levers available to us. One of the things that we are working on is something we call talent flow, where we actually move people from various parts of marketing into other teams in order to meet area of higher business need. You can imagine it's a complicated dance. We're not moving headcount, we're just moving people to other teams. But it also starts to demystify this idea that the therapeutic area knowledge is so precious. You can actually move someone from our stroke business to our immunology business to our oncology business and actually leverage a lot of the same skill sets that are required to be great at marketing. So we're working through this right now. I just sent an email this morning sort of approving a handful of these to go from areas of lower impact to our business to areas of higher impact. So we have a lot on our plates as it relates to Genentech and One Marketing. This is sort of a handful of the things that we're grappling with this year. When I forecast out into the future and what I think we'll be doing in 24 and 25, leveraging all of the technology and infrastructure that we have currently to move into a real digital future for marketing. What I hope to have, though, is a engaged, inspired group of people to make this change, right? I'm one person, I cannot make it on my own. Leveraging my advocates, placing them in teams, leveraging talent flow so that we have them everywhere they need to be. Aligning our reward and incentive structures, and at some point, for some folks for whom will not get on board, having the courage to make decisions about where people do go, right? There is a point where you're either on this bus or you're not, and we're not there yet, but there's that acknowledgement that sometimes you have to have those tough conversations so that you have the group of people that you need to move forward into the future. So this is a bit of a glimpse of what we've been up to here at Genentech. As I said, I'm really excited to be in this role, really excited to be here at this conference and learn from all of you and get to know most of you over the next couple of days. I think this was about all I had as far as content. I went through some of my headwinds and tailwinds. And I'd like to open it up for Q&A. Thank you.
Thank you, Erica. Over the next few days, if you have a question, we want to get to know you that way. So if you have a question, please stand. We'll get a microphone to you. Tell us who you are and who you're with. So just raise a hand, and Barbie or I will get over to you. That's okay. That's how I keep my girlish beard.
I'm Bradley Deutsch with Atheron Health. I love everything you said about removing silos, bringing everybody together. Yeah. My question for you is, knowing that there are agency partners involved as well, how do you get them to share in that level of thinking when we know that agencies work very much in a siloed way?
Yeah. It's a great question, and part of how we're trying to do our agency restructure, actually working at the holding company level, so that we can have as many different solutions that are brought to us as it relates to that specific work. We also think about novel ways of managing the compensation models for our agencies. I think we're in this sort of, I call this like death spiral of making more things, right? We're all incentivized to make things, we don't measure them. The ad agencies are incentivized to create new things, but we're not focused on impact. And so how do we think about structuring contracts that actually leverage and inspire around the impact that we can have to our business so that we sort of take the stuff out of the system, if you will. I think the other thing for us, and I've been challenging, particularly my holding company partners, to think a lot differently about, even our portfolio, but how we think about our therapeutic areas, right? You could imagine organizing your agency models around phases of the life cycle of a product. You could do launch, you could do sort of mid-market competitor entry, and you can do sunset. You could also broaden what you think about as a therapeutic area from, say, oncology to immunology to acute, chronic, and rare. Right? Like there are other ways to think about, particularly our portfolio, that I think would get us interesting partnerships with our agencies that just challenge our status quo of the way we've always done it. I don't know if that answers your question.
That's great. Hi, my name is Margie. I work for Cargo. And I'm just curious, you mentioned you're excited about pushing the boundaries in the digital future.
Yeah.
What are the products or things that you're pushing your teams to look into or to kind of like innovate on that you're already doing?
Yeah, and I worry this might be an unsatisfying answer. The biggest thing I'm trying to challenge my teams to do is to think about content and think about marketing as storytelling. It sounds so basic, but we have been so enamored with the way we've done marketing over the last 10 years that I think we've gotten away from simple things like modular content and thinking about how do we tell not one story, but dozens, and you can optimize them in the market leveraging data. That's all I'm trying to get them to do over the next year or so. It sounds really, to me, things that you all are living and breathing, and that is bread and butter marketing in any other industry, but it's still relatively new for us.
Hey, Brendan Gallagher. Hi, Erica. Thanks for sharing this. Super inspirational. My question is around influence around the technology side of the business as well. So it's one thing to be able to inspire transformational change within your marketing organization, but a lot of times we run up against the old styles of working when we get to our technology or business intelligence counterparts. Do you have a remit over that as well, or are they on board for this change?
That's a really great question. I don't have a remit over that. Our digital experience group runs adjacent to us. It's more of an operations group, and it's really interesting the variety of responses I get. Most of that group is like, thank God, someone on the marketing side, on the business side is actually speaking our language and wanting to move us into the future. And then I've got another group within that organization that's like, yes, but what she's talking about sounds a lot like my job. And so there's probably, and I've been in conversation, obviously, within my leadership organization around, there's probably gonna be a couple collision points here where we'll have to just navigate through. I think for me and for my peers and partners, being focused on the goal and the outcomes that we're trying to drive is most important. We will figure out the people. We've got great people, and right now, more work than we have people to do. And so, trying to kind of take the fear out of, oh, but my organization is going to be absorbed into marketing, and what is that going to mean? Again, keeping people focused on the work, but also giving them a view into what is possible for their careers and their career development. We cannot ignore that going forward. So it's going to be an interesting couple of years. As a side note, I've hired a head of digital marketing, and he's fantastic, kind of sits in that sort of unicorn spot of speaking both the marketing and the digital and the tech, but he sits in the marketing organization. And so even just his placement in the organization is challenging a lot of the status quo, and luckily he's got the sort of disruptor mentality to continue going forward, and he and I are in a lot of conversation about sort of how do we manage the relationships but continue to go forward.
Hi, I'm Emily with Eversana In Touch. I loved what you said about the shift from deep therapeutic area knowledge to more personalized insights. Would love if you could expand a bit on how you've been able to accomplish that.
Yeah, so it's a great question. The first thing that we're trying to do is actually move people around in the therapeutic areas so that you start to see the ties that bind among the various customers that we touch, right? And this is where I get some interesting insights around what happens if we thought about our business around rare disease as distinct from chronic. Historically, most of our portfolio, I think as you're aware, is driven by oncology, and that has sort of been the kids in the varsity jackets walking around the halls in our organization. And so if we start to decouple a little bit of that and share knowledge across the therapeutic areas, you start to say, aha, actually, Breast cancer treaters are not that different than rheumatoid arthritis ones. You're trying to optimize for quality of life because you know your patient's going to be on board with you for many, many years versus more episodic care. And so, and trying to kind of break that apart, that's the simplest way, is to just move some of the people around. The other for us is leveraging our insights group to really show and unlocking the power of data. When you have those personalized insights, you can deliver that personalized message and actually move the market. And trying to reveal that, we're running a couple of pilots where we're actually able to see that happen in some of our larger businesses and beginning to think about how we scale that thinking across the organization. It's what we're up to.
The oncologists wear varsity jackets, is that it? Really?
Well,
oncology marketing at Genentech. What do the neurologists wear, by the way?
No, I would say if you were in oncology, you were viewed as,
right,
yes.
Right.
But I don't know what the neurologists wear.
Okay, I was just good. We could break this down. It would be interesting. Yeah. I wanted to follow up on a couple of things that you mentioned. First, about the agency rethink and reorganization. Yeah. Have you made broad strategic determinations yet about how you want to break this down? Do you want a single AOR for Genentech that's working across all of your brands now, or are you still going to retain individual agencies for brands? Are you going to rethink the ways in which you're organizing, how many agencies you're using?
Yeah, it's, so what we've done is I sort of stood up a work product team to kind of really examine this, particularly for our agencies. Obviously, this is a hot topic across our organization. And where we've landed is we can't have one agency serve our whole portfolio. Very few agencies can scale that large, and our portfolio runs the gamut from stroke to oncology. It just would be too hard of an ask. So what we're doing is working with our holding company partners and saying, here is what we need to do to move marketing into the future. Almost agnostic of therapeutic area. Propose us a solution that will help us get there. And what I'm trying to unlock, particularly to kind of decouple the familiarity bias that shows up, is to give the holding companies the freedom to select a solution for us. Could be a fantasy football model where they pull from a handful of agencies. It could be that they have one or two that can serve our business. But I want to free them to be creative because we don't know what we don't know. And many of these holding companies, as you're aware, serve many other industries. There's so much that we can learn from these other industries, and I don't want to box us into just gray or just VML/Y&R. Ultimately, I think we'll have 5 or 6 agencies that can handle the breadth of our portfolio from a creative side. And we're contemplating whether or not we add 1 or 2 specialized agencies as it relates to market and patient access. That's a place where we have to get better as an organization, and we know that that's very specialized content and customer interactions.
I also want to follow up on you used a great turn of phrase, culturally competent messaging, which I love for alliterative reasons alone, but could you tell us a little bit more about your thinking there? Because I know that the more personalized and one-to-one and patient-first approach is what you've got in mind as the aim here. But when you think about culturally competent messaging, what does that mean to you? Are there any examples yet of you guys doing this in the field? Yeah, I can share. For me, and I've shared broadly in my organization, that we have to get away from that word multicultural marketing. I think it otherizes it. And for me, cultural competence and marketing is embedded in your strategy. It's embedded when you think about your personas and your segmentation, both of your HCPs and your patients in the simplest of forms, right? But specifically when you think about interacting along patient lines, for me, it's not, I'm going to do my marketing strategy and my content, and then I'm going to add in a culturally competent message. It has to be built in. In order to do that really well, it's my belief that you have to work with the community. This isn't an ivory tower exercise, right? And so we have a couple of really great examples where we've done some things in really hyper-local communities. We have a campaign running right now in New York. I think I shared with you our Love Letters campaign, which is about breast cancer screening, targeted toward the Latino and Hispanic communities there. And we worked with those communities to create that campaign. And that's one example of sort of starting where the need is and addressing it in a very sort of culturally competent way from beginning to end. And what did that actually look like in terms of working with the community? How was that actually structured? How did you go about doing that?
So I didn't mention earlier, one of the other transformations that Genentech did a couple of years ago is we've completely overhauled our customer engagement model. And so instead of being by therapeutic area and you know, sort of dividing up the country however you can, we actually have local ecosystems. We have 32 of them is how we're organized. And essentially, the way this operationalizes is marketing partners with the ecosystem because they are embedded. And by ecosystem, I think of it as, the best way to think of it is like where healthcare decision-making happens, right? And so it's not necessarily along state lines. It includes some of our more national partners, but we have teams that are aligned in such a way that they have the insight, and when our marketing teams plug into that, we can sort of really unlock a lot more value and do so in a culturally competent manner. So we've got a couple of examples starting to pop up, but what I want to get our teams beyond is taking a piece and translating it into another language. Like that to me is, that's not good enough. We have to speak in a way that actually resonates with folks that we're trying to interact with, and we have to embed that into our practice.
Erica Taylor, thank you so much. That was a
Thank
great
you all
opening.
so much.
Thank
I
you
really
for getting
appreciate
us
the
started.
opportunity.